Most women are shocked when I tell them this, but testosterone is one of the most important hormones for female energy, metabolism, confidence, mood, sex drive, and even mental clarity. It typically starts to drop slowly in our 30s and more dramatically as we approach menopause in our 40s. And yet, women just don't have a lot of clear information on the options available. I'm Tina Jacobs, physician associate, owner of Silk Life Medical, and your hormone expert. Today, I'm going to break down the 5 safest and most effective ways we can replenish your testosterone, because the truth is, there is no one-size-fits-all approach to female testosterone replacement. And if someone tells you that every woman should be on pellets or every woman should use injections, that usually reflects what's most profitable and convenient for the clinic, not what's best for your body. By the end of this video, you'll understand all 5 options, the pros, the limitations, how they're best absorbed, and who each one works best for, so you can make a confident, personalized decision with the right practitioner. Now, there are 5 main forms of bioidentical testosterone available for women. All 5 can be safe, all 5 can be effective. The real magic comes from matching the right option to your labs, your symptoms, your genetics, and your lifestyle. Let's start with injections. Now, injections are extremely common with men and increasingly more helpful with women. You can administer them in 2 ways, subcutaneously a couple times a week or intramuscularly once a week. Let's take a closer look at the subcutaneous injection. This tiny needle goes underneath the skin. So it's a tiny needle inserted into the fat tissue of the belly most commonly, and most women find this very easy and comfortable. You can see it's super tiny, similar to a mosquito bite. Because of the way the subcutaneous injection is metabolized, I recommend injecting 2 to 3 times per week for most consistent results. Less commonly, some women prefer an intramuscular injection, which means into the muscle. Because it has to reach the muscle, it's a larger needle, but the benefit is that it's only injected once per week. There are some great benefits to injections overall. They're highly adjustable, so you can start at a low dose and fine-tune the dosing week to week. They're very strong and predictable as far as absorption. They're great for women who need a more robust response, and it can be shipped directly to you. Most women notice improvements in that energy, fat burning, muscle tone, mental clarity, sex drive within just a few weeks. Now, here are some possible downsides to the injections. They require giving yourself a poke 1 to 3 times per week. That's not going to be perfect for all women. If you haven't done an injection yourself before, there is a small learning curve to preparing a syringe and injecting it. We recommend doing the first injection with us in office if possible, but most women are really surprised at how easy it is. Secondly, if you need estrogen, progesterone, DHEA, pregnenolone, these other hormones that can also decline at similar time, these are going to be separate treatments. They aren't combined into the same injection, but still can be easily used separately. And lastly, some women do see some mild peaks and dips in their treatment, especially with the once-a-week IM injection, with more effective treatment closer to the injection and wearing off on that final day. And so it's still, the injections are really great and still one of the most effective options that we have for testosterone replacement. Now, here's option 2. The BLA tablets. That stands for bio-lymphatic absorption. These look like regular tablets, but absorb very differently. Here's an example of a BLA tablet. They absorb, instead of going directly through the liver, they actually get absorbed mostly through the lymphatic system. This helps maintain levels consistently and mostly avoiding the impact on clotting risk. The benefit with a tablet like this is that the once daily dosing is very easy and convenient. You're able to get very consistent levels with daily dosing, and it's easily shipped directly to you. You can easily combine the testosterone tablet with estrogens, progesterone, DHEA, and pregnenolone, and it's great for women who just want all their hormone therapy in one easy tablet. There are possible downsides. A small portion of the BLA tablet still passes through the liver. For most women, this isn't an issue, but if you naturally have a higher hemoglobin and hematocrit on your labs, which is blood thickness, you have a high personal or family history of blood clotting, then we want to be extra cautious and might not choose this as the best option for you. And if you're including estrogen with your testosterone, then the BLA tablet, you have to take some extra consideration. Some women, because of their weight or genetic predisposition, are going to be prone to converting that good estradiol into the more inflammatory estrone with anything that goes through the liver even a little bit. Now, not every woman converts this way. Sometimes this leads us to choose another method. It's really something to discuss with your practitioner. Still, BLA tablets remain one of the most commonly used and best tolerated options in my practice because they are so consistent and convenient to use. Now, let's go to option 3. That's the oral dissolvable tablets. Specifically, it's going to come in 2 major forms, a sublingual or a troche. Let's talk about the sublingual tablets. Now, sublingual is going to look very similar to the BLA tablet, but you place it under the tongue and it absorbs very quickly through the oral mucosa. Troches, on the other hand, they look like these hard squares, kind of like candy. You put that square lozenge between the gum and the cheek, and it melts much more slowly, but you can put it there and go about your day doing other things. Both work pretty similarly, but the troche is just much slower to dissolve. Both are going to be a fast-acting form. So this means they last only about 12 hours, so they don't have that 24-hour coverage. So most women need to take them twice a day. The benefits is that it's still, if it's absorbed through the oral mucosa, we can avoid that liver metabolism, avoiding certain risks. You're less likely to increase estrone if you're, prone to that estrone conversion in comparison to the BLA tablet. And it's still, easily a tablet that you can easily combine estrogen, DHEA, and pregnenolone in. It's very customized and predictable. Possible downsides are going to be that for some women, twice daily dosing is cumbersome, or they just forget to take that second dose in the afternoon or evening. Also, we typically avoid using the progesterone in something that's more fast-acting like these forms because fast-acting progesterone can cause drowsiness. So we typically keep progesterone separate when using a sublingual testosterone or estrogen. For the troches, they can melt as far as how you're storing them. So if you leave them in a hot car, you might be out of luck. So they recommend storing them in the fridge, but usually as long as they're at room temperature, they're not going to melt. These options are a great match for women who want something strong, consistent, not processed by the liver, and for those who want a daily formulation but are prone to that estrone conversion due to excess weight or genetics. Now, here's option 4. The testosterone pellets. These tiny pellets are inserted under the skin in the hip area and dissolve over the course of 3 months for women. This is what your pellet may look like. So it comes in this little tube. This is a 25 milligram pellet. It's so tiny. And that gets inserted into the fat tissue of the hip with a tiny insertion and slowly dissolves over the course of 3 months. The benefits are going to be that you don't have to think about hormones for daily. You just have to have a procedure every 3 months. So you don't need to remember to take pills if you're someone that just forgets things or tablets. You don't have to stab yourself. You just have to be in office every 3 months and be willing to do that procedure. For most women, if it's dosed correctly, the pellets will have very steady release of the hormones, which has a lot of benefits. It's a great option for women who need that higher and more sustained testosterone levels to get the results they're looking for. Pellets can be testosterone alone, or you can include estrogen and or progesterone for women, and it's not going to cause drowsiness with adding the progesterone that way for most women. Now, the downside is it's an in-office procedure, so it can't be done over telemedicine and it can't be shipped direct to you. You need to make time to come into the office at least 4 times a year. It's a very small incision, only requiring a steri-strip, no stitches, to close, but we do have post-procedure recommendations, such as avoiding intensive exercise and swimming for at least 5 days post-procedure. So for someone who has a very active lifestyle day-to-day, it might not be a good option. And then although we can treat any symptoms, you can't remove them if the dose is too high. So you need to be cautious when starting. Dose adjustments only happen every 3 months instead of week to week. It's not ideal for very thin women with little fat in the hip because you may feel the pellets in the hip with certain movements. Like I had one woman complain about who was thinner and had them done, and she noticed it when running. And you may be more prone to those extrusions if we can't put it deep into some fat tissue. It really requires somebody highly experienced to get you consistent results. I always start the pellets at a lower dose for someone's first starting to avoid over-treating, and then we test the labs at 4 weeks to see where you're at, evaluate symptoms, and do a boost if needed. That boost is only required with the first session. After that, you should be able to get your dosing every 3 months. The pellet option is a fantastic option for a lot of women. It's still just not the right fit for everyone. Option 5 is creams or gels. Now, this is an example of a gel container, but a gel or a cream can come in this container called a toppy click. This allows you to dispense the exact amount prescribed. In most cases, you'll be directed to find an area of thin skin, usually the inner arm or inner thigh, for best absorption. In certain cases, we may recommend vaginal application. For example, you might be prescribed 1 click twice daily. So you'll turn the dial to get that 1 click and then apply to the prescribed area, avoiding any hair follicles. Now, the benefits of this is it's very steady absorption and very gentle. We can combine multiple hormones, including progesterone, without causing drowsiness. So you can do testosterone, estrogen, progesterone, DHEA, pregnenolone, all in one. Great for women who don't want an oral form because they have a sensitive stomach or don't want to deal with needles or a procedure. It's easy enough. Vaginal application can be incredibly effective for sexual sensitivity, libido, and correcting irregular bleeding with progesterone. Now, of course, there are some possible downsides. You have to be careful when applying that you're avoiding the hair follicles. Hair follicles have an enzyme that actually converts testosterone into DHT, dihydrotestosterone, and too much DHT is what can cause acne or hair thinning. So not ideal for women with a lot of body hair. It may not be ideal for someone who's acne prone or already dealing with hair loss because of that. So also, lastly, there's possible transference. For example, if you put this on and then minutes later I go cuddle with my partner, it could possibly be transferred. And lastly, creams and gels typically just aren't as strong as the other options. But still, for the right woman, this steady, gentle dosing is very effective. Now, the clear takeaways. No single method is best. The right method is the one that fits your labs, your biology, your goals, your lifestyle. And if a clinic offers one option, that's a limitation of the clinic, not a reflection of what your body truly needs. A good practitioner will help you make a decision based on evidence, personalization, and how you really want to feel, so you can truly feel like yourself again. Now, if this video helped you understand your options more clearly, please subscribe, like, and share this with another woman who deserves that clarity. If you're in Colorado and want personalized hormone optimization, you're welcome to work with me directly. If you're out of state, you can still schedule a consult to explore what might be right for you. Women deserve individualized care and information that empowers us, not confuses us. I hope this video brought you one step closer to that.